Believe them, include them, fund them.
Over half of working women are dealing with menopause symptoms. It's almost unbelievable to think that it has taken until about a year ago for the U.S. employers to start to recognize that.
What it left me realizing was that we needed a whole new group of innovators and an ecosystem really to create a new wave of women's health innovations in the U.S.
I want research, right? I have metastatic breast cancer. I hope that it turns from a terminal illness to a chronic one. And I'm very lucky that I'm in this stage where I have treatments to keep me alive, but really focusing on us deserving to live. And that, the $1 million we raised, could potentially be a drop in the bucket in research. But it's allowed us to create a whole tech startup that helps thousands of patients.
The world is evolving. The problems we're facing are too big to be solved by any organization alone. A lot is uncertain, but one thing is for sure: change is coming. And the voices you've just heard are the people driving it, entrepreneurial leaders. Welcome to From Problems to Possibilities, Entrepreneurial Leadership in Action, presented by Babson College. On this podcast, we'll meet the entrepreneurial leaders in the Babson community and beyond who are working on solving some of the world's biggest problems with the passion and skills that the world needs today. How does an entrepreneurial leader look at a problem and then get to the solution? I'm your host, Maddie Poirier, and together we'll go from problems to possibilities. According to the Global Entrepreneurship Monitor's 2023-24 Women's Entrepreneurship Report, startup activity among women has risen steadily over the past 25 years, even as they face headwinds related to cultural perceptions of women in business and limited access to capital. One of the effects of this activity is women entrepreneurs who are taking problems affecting women in healthcare and creating business solutions to address them. In this episode, 4 entrepreneurial leaders in the women's health innovation space, taking problems in women's healthcare and leading the way to possibilities. We'll hear from a breast cancer patient turned entrepreneur leading a nonprofit, one of Babson's own renowned health scholars, the co-founder of a venture capital firm investing in women's health startups, and a business partner driving growth at a company that empowers women to take control of their conversations about fertility and menopause. Now, on From Problems to Possibilities, women entrepreneurs in women's health.
Less than a year after giving birth to her first child, Elissa Kalver was diagnosed with metastatic breast cancer.
We were fortunate enough in October to have a segment on Good Morning America. And we realized from that segment we reached over 2 million people, our registries nearly doubled.
Born from personal experience, a young mom going through chemo, realizing there's a better way to streamline the flood of goodwill from friends and family and channel it into things that a patient really needs.
This segment on Good Morning America propelled Elissa Kalver's dream to new heights. But it was not the way she expected her life to go. Just a few years before, Elissa, a new mom, had received the earth-shattering diagnosis of breast cancer. Her diagnosis came with an even more devastating word: terminal. For Elissa, it was a life-changing revelation. If she could never cure her cancer and must always fight it, then she would help others to do the same. And WeGotThis.org was born. She used the entrepreneurial leadership skills she gained at Babson and in her professional life to embark on what is now her life's work, helping others undergoing cancer treatment even as she battles it herself.
Just over 3 years ago, I was diagnosed with stage 4 breast cancer. And I have no family history, no genetic mutation, so at the age of 34, that was very surprising. And when I was diagnosed, it was right before my daughter's first birthday, and I remember everyone asking how they could help and what they could do. And as much as I appreciated it, I thought back to when I was pregnant or getting married, and it was much easier to ask for help. Initially, when I started chemo, everyone was like, take care of yourself, worry about yourself, just get better. And it was really in that 5th round when I started being like, if this is all I'm focusing on, like, this is a huge downer. I don't feel well, I'm not working, I'm not focusing on something beyond me. And that's when I was like, I need to at least do something during this time that makes me feel like this is bigger than me. Made some phone calls to some fellow Babson alum, kind of brainstorming this idea, much smaller scale, like just breast cancer patients, maybe just Los Angeles where I live, just feeling like I don't know how I could help everyone affected by cancer. My friends Alex and Alexa Carsos, both Babson alum, they said, do you mean like baby list but for cancer? And that's when it like dawned on me like, oh, wow, yes, we do this for so many other things. Why not do it for cancer treatment? And that's when I really went down this path of making sure it didn't already exist, because if it had, would have been happy to just help with that initiative since I felt like this was a mission that I really aligned with. But when I saw that it didn't exist, that's when I was like, this really needs to. The whole goal is for patients and thrivers, survivors, whatever you identify as, to get exactly what you need, to make it really easy to ask and receive help, but to also make it easy by the supporters and people who are also affected by cancer to give that help to you. And so bridging that gap is really what my life's mission has turned into, and that's what WeGotThis.org is.
Before starting WeGotThis.org, Elissa did more research. She found out that others had tried and failed to execute a similar idea as a for-profit company. But she knew that the need, namely the gap between cancer patients and the people who wanted to help them, still existed.
When I was looking into it and realizing that it never exists as a nonprofit, but it had tried to exist as a for-profit, I looked into that as a way of like, okay, if it tried to exist and failed as a for-profit, but it's a need that people want, then I need to figure out how I can do it as a nonprofit. And I did explore funding and VC funding, and I think that there's a future for this to be bigger and beyond cancer. But for the immediate need, I felt like my biggest service to myself and to the cancer community was to get something launched as fast as possible and make it so that we can help immediately. And I just had the confidence that I could do that as a nonprofit rather than getting investors and having to, maybe this would exist in 5 years. I needed it to exist now. I started a GoFundMe for it to raise the funds to get this idea going. And I didn't have it all figured out. I kind of made a video. Here's what I'm thinking. Here's what I needed when I was diagnosed. And we raised over $100,000 in that GoFundMe, which, I'm sure that there are plenty of people who would have donated no matter what I said as a support for me because I hadn't asked for funds or anything for myself. But not $100,000 worth. That's when people I didn't know started contributing to it. And that's when I started to realize that this is much bigger than what I'm thinking and in my circle. This is a need within, people understanding cancer treatment and what goes around it or wanting to understand it. So it's been really exciting to see how it grows and the level of support from major brands like Bombas and Crocs and so many other things on the corporate side and then also on the nonprofit side. We partner with tons of nonprofits because no one else does what we do. So we work a lot with Teen Cancer America and Leukemia and Lymphoma Society and, all of these nonprofits near and far to really just try to spread the word to make sure that cancer patients know that this exists. And then also, of course, trying to drive funding to make sure that it can continue to exist.
For Elissa and her team, it's been an incredible journey, from getting a boost on Good Morning America to raising over $1 million. And even as her cancer wages war on her body, she's got plenty of ideas for the future.
That first $100,000 in GoFundMe was 3 years ago. We're right now $25,000 away from hitting $1 million. By the time that this airs, hopefully we'll hit the $1 million raised. And that was all done through fundraising and peer-to-peer fundraising. While I'm still very much in chemo, like I have stage 4 breast cancer, I'm in treatment for the rest of my life. And it is so fulfilling. And now we're kind of at this turning point where it's like, okay, I do understand why this wasn't done as a nonprofit before because it's a hell of a lot of work and money, and now we're really going into filing for more grants and trying to get some bigger funding now that we've kind of done this paradigm shift of people understanding why this is important alongside research. I think that I've really run it like a business. So while it is a nonprofit and we follow all those structures, in my mind, the way that I've adopted partnerships and relationships is the same that I used to do that in my career in financial services. Like, I go into it with the mindset that, like, this needs to be a healthy functioning business to be a healthy functioning nonprofit. And there's not many differences of how it runs other than the tax exempt and some of the mission driven aligning things. But like in the actual work that we do, you know, it's the same efforts and organization and growth plans and business planning and all of that stuff that I learned from Babson.
I think on a busier day, I'm actually starting my mornings with one of our programs. So we run a program for global surgery, and so I speak with surgeons from around the world first thing in the morning. And I'm getting ready for classes that begin here shortly, and so I may be interacting with graduate and undergraduate students in the classroom, and also having calls with my colleagues.
Our next guest, Dr. Wiljeana Glover, is an entrepreneurial leader at Babson College. She's an associate professor in operations and information management and the founding faculty director of the Kerry Healey Center for Health Innovation and Entrepreneurship at Babson, where she co-leads 3 research teams and develops strategy and programming for the center, including the Global Health Innovation Lab. She's the recipient of numerous awards and accolades in both the entrepreneurial healthcare and academic spaces, including the 2024 Tumiani Foundation Global Health Educator Award. And she's here on the podcast today because of her long list of achievements in the healthcare systems innovation and improvement space, helping us understand how women entrepreneurs are changing the narrative and the numbers.
When we talk about healthcare innovation for women, I think it's really helpful for us to step back, and we often do this in the classroom, and sort of remind ourselves of the history of how women have been either included or excluded in pathways to healthcare innovation. And a large part of that lies into our history of clinical trials. The NIH Office of Research in Women's Health does a really great summary on this history, and it basically starts with, in 1977, the Food and Drug Administration policy recommended excluding women of childbearing potential from phase 1 and early phase 2 drug trials. And this may have come from a good place at the time, but perhaps a limited understanding. And so because women were excluded from these early stage trials, it led to a shortage of data, but I think also a sort of perspective that women shouldn't be included in trials. And it wasn't until 1989 when NIH announced a policy saying that women could not be excluded from trials just because of cost or other concerns, that there should be a concerted effort for women to be included. This was just a policy, not law, until 1993, and then that law was updated in 2017. So this is still really recent history that we are learning the sort of the aftermath and the effects of not including women for so long, and we're sort of playing catch up on what we understand about many of our pharmacological solutions and devices, et cetera, and starting to include women more in these clinical trials.
Even though this point is focused on the U.S., it's really helpful to understand this context. There is a lot of biopharmaceutical research done in the U.S., sometimes accounting for over 40% of the R&D being done worldwide. Having excluded women in the past from this research could very easily have changed the data about women's health and the way the scientific community understands it. So now, in our current state, where leaders in women's health are uncovering these gaps, how do we understand their impact?
There are at least sort of 2 factors that contribute to women's ability to start a business and how this actually impacts women's health. So one thing that I think is important as sort of a starting point is that we know from our work with Professor Yunwei Guy, Aaliyah Crocker, and Candy Brush, so the 4 of us have been working together and have found in our studies that in general, a region with more health entrepreneurs have improved health outcomes. And we believe that this might be due to a few few factors. One, perhaps entrepreneurs that are in a particular region, they're closing access to care gaps that might be left by larger public and private health systems. And we're still seeking to understand the extent to which this might be true for women's health in particular. Another research team that we have with Professor Desi Pachimanova and Z. Lee, we cite previous literature that suggests that specifically for women and minority health entrepreneurs, they may be more likely to care for underserved populations, so including women, Medicare and Medicaid patients. And perhaps this is partly due to their greater cultural congruency to the communities that they seek to serve. Whatever the solution is, it needs to have a really strong evidence base in order to have sustained health outcomes over time. And then finally, we have to achieve both health and economic outcomes. And for some founders, particularly if they come out of clinical spaces, they don't necessarily have as much experience in making sure that the economic outcomes are sound. And this is back to why partnership can be really helpful. But just making sure that we're tracking and we're measuring both whatever the health outcome, appropriate health outcome is for the solution, as well as making sure that we remain fiscally solvent through the course of the venture.
When asked about the biggest stumbling blocks for women starting these companies, Professor Glover turned the question into something of a rallying cry. Take a listen.
I think I'd say three things. It's to believe them, to include them, and to fund them. So in terms of believing them, when women share their experiences of what has happened to them in healthcare systems, believe that experience. I think of all of the stories of Black women, myself including, where we share, harrowing birth experiences, or that woman from a rural town that shares her fear of seeking an appointment. Believe them, because in hearing those stories and having empathy towards those stories, it can open up new opportunities for solutions. Including them just means, including women in those clinical trials, in the boardroom, at the bench as scientists, at the bedside as physicians, and to continue to include women in clinical leadership positions as well, like being founders, being, VC partners. That inclusion is really important in order to have individuals at the table that see these opportunities and know how to move these opportunities forward. And then finally, funding them, right? So studies from groups like Femtech Insights still suggest that female founders are funded at a lower rate than their male counterparts. And so we continue to need more study of this phenomenon, why this happens, as well as individuals that can advocate for increased parity for angel and VC groups. I think at the same time, they are building a community of women who they know their own needs, they know their own lived experiences, and they're seeking other founders that have these experiences and are seeking to fund these organizations. And so I think for the VCs that see those opportunities, they will do really well in partnering with these entrepreneurs.
I run along the muddy river. It starts my day on an amazing high that I take with me through the day. I wish I could do it 7 days a week.
Elizabeth Bailey, heard here taking an early morning run through her neighborhood in the Boston area, is the co-founder and managing director of Foreground Capital, a venture capital firm investing in women's healthcare solutions. For Elizabeth, this work specializing in investments in women's health innovation is a natural fusing of her background in venture capital and her experience running a global health technology innovation program at Mass General Hospital. Through this role, Elizabeth witnessed the explosion of women's healthcare innovation happening around the world and wanted to understand why this huge market's needs were not being met in the U.S.
In many cases, the environments in the U.S. were not so different from places that we were doing work, even in developing countries. And so what it left me realizing was that we needed a whole new group of innovators and an ecosystem really to create a new wave of women's health innovations in the U.S. And that really inspired me to bring a lot of those learnings back and go on a learning journey of my own in the U.S. to understand what was possible here. I also had a strong belief that if we could turn that engine of innovation on to the women's health space, we could really accomplish a lot. And so I started my learning journey by talking with entrepreneurs who were innovating in the space, investors who had tried to do women's health investing but couldn't, investors that were indifferent or hostile to women's health investing, just to understand what were the barriers that we were facing in terms of getting more women's health innovation into the world. And so there were many, many problems. Data was a really big piece of that. If you look across the entire continuum of healthcare innovation from kind of early stage research and discovery to clinical trials and development, all the way into to commercialization, I think you're missing women's voices, data, and certainly funding. What we found as we went out to talk with lots of VCs in the women's health space is, there are no exits, there are no success stories or very few. And we don't know this space very well, so we're not really ready to jump in until there's a critical mass of data or evidence showing that you actually can make money here.
Elizabeth and her co-founders had learned enough to want to dive in. They raised their first fund with investors who were willing to accompany them in their mission to be bullish on the women's health opportunity, help to de-risk the market, and collect the data to support this endeavor. Foreground Capital now runs as a specialty firm focused in women's health and holds the largest portfolio in that space. One example of their successes involves a company they invested in called 28 Health.
28 Health is a digital-first women's health company providing mainly telehealth and care coordination for women across the U.S. And their particular focus, which we loved, was that they wanted to serve the Medicaid market, which there are lots of telehealth companies out there serving women. Many of them are doing really great work. Very few are actually serving women in the Medicaid market. In the US, I think 45% of births are Medicaid. And so if you're missing that piece of the market, you're missing a huge opportunity. So I think there's a business opportunity, but also from our perspective, an opportunity to have a huge impact on women's lives who come from marginalized community, low-income communities, rural communities. And so 28 Health now, having scaled over the last several years, is in 43 states, and they provide really necessary reproductive and maternal health care services digitally. There are lots of statistics around the contraceptive and maternity deserts that exist in the US where you don't have OBGYN care. You don't have access to contraception. This company has really embraced the idea of making sure that all women have access to basic reproductive health care. Not all healthcare can be delivered remotely or virtually for sure, but there are many things that can be delivered virtually. And 28 Health, again, started with the hardest to reach populations and has had tremendous reach and tremendous impact on communities that are often left out of these other telehealth companies that are cash pay and really just focused on people with private insurance. And so we loved both the mission of the company, but also the tremendous business opportunity that we thought that it created. And we're really seeing now this company scale in a way that is super exciting and having a huge impact on women's lives.
If you're a women's health startup or have an idea in that space, Elizabeth's got a few tips for companies looking for funding.
So I think the first piece of advice that I always give entrepreneurs is to really do your diligence on the investment strategy of a fund and really validate that before and during a first pitch, because everybody's time is valuable and you don't want to waste time if there's never going to be a match. And I guess a corollary to that is really do your diligence to make sure that you actually want to work with the fund you're pitching to. So talk to other founders and entrepreneurs that are in their portfolio, because you're building a partnership and you want to make sure that you're partnering with someone that shares your values and your vision for your company. And I think sometimes there's a power imbalance between investors and entrepreneurs, and I really want to empower and encourage entrepreneurs to pick good investors that align with your values and your interests, and not just say yes to any check writer. And that requires a little bit of work up front, but I think sets everybody up for a better chance of success down the road. I think something we talk a lot about in the women's health space is that we hear a lot about the unmet need in women's health, and there's huge unmet need. But just talking about the unmet need and the lack of progress that we've made in the space doesn't actually move the investment activity in the space. What will move the needle and get investors off the sidelines is to be really clear about what the business case of whatever your venture is. Some entrepreneurs talk about personal stories that they've had, and I think that is helpful. But I think at the end of the day, investors have to generate a financial return. And so making sure that whatever you're building has a good business model around it. Making sure you identify who the customer is. In healthcare, that can be complicated. Sometimes it's the patient, sometimes it's the provider, sometimes it's the insurance company, sometimes it's the hospital system. So making sure you understand all those different pieces and how they fit together to ultimately make money for a business. And it doesn't mean that you won't have amazing impact on changing women's lives, but that alone is not enough to get an investor to write a check into your company.
If you do get VC funding with a company like Foreground Capital, it's only the beginning of the road. There are some things your company needs to be prepared to do as a good partner.
An investor-entrepreneur relationship, the best ones are really a partnership. A partnership means that you are asking tough questions, you are sharing the tough parts of the business. So one of the most frustrating things is for entrepreneurs to only share the good, and not talk about the real challenges that they're having. And then investors, whether they're just part of a syndicate or whether they sit on the board, we need to understand what those real challenges are so that we can help, we can support and be part of the solution. I think that is a transition that entrepreneurs need to make from when they're pitching, which is everything's exciting and wonderful and you're in sales mode, to post-investment where you really need to partner with VCs and think of them as an extension of your team to help problem solve when you have challenges. We often work with our companies to help them make the health economics case, because in addition to improved health outcomes, you need to show that there's cost savings to the system in order to unlock insurance dollars and healthcare dollars from the system as a whole. And so sometimes that's a really missing piece of a company's activities. They're much more focused on the health outcomes, which again, I wish that were enough. But making that health economics argument early and collecting data to prove that out ends up being really essential to a company's ability to scale and grow.
I'm a cyclist, so I go out on my bike, depending on the weather, probably 4 days a week, just to recharge the batteries. I travel globally and in the US probably, I'd say like 25 to 30% of the time.
Mary Tenebra, who earned her MBA at Babson in 1990, is what you might call an unassuming powerhouse, zipping around on her bike in her hometown of Charleston, South Carolina. She currently sits on the board at Babson's Kerry Healey Center for Health Innovation and Entrepreneurship and has been plugged into the entrepreneurial leadership community for over 30 years. Currently, she's the business partner and chief commercialization officer at Inflection, and her resume lists some of the biggest companies in the world.
My first job was in what I'd call a tech startup in the 80s.
The most powerful PC in the world. The most powerful portable in the world. Compaq. It simply works better.
So when I joined over 12 years, we had about 800 to 1,000 employees when I started. And by the time I left, we had 56,000 employees globally. So I really got to see that journey, moved up the ranks, helped shape ideas, had a seat at the table in a lot of the future development.
After Compaq, Mary did a long stint at Mercer, and then COVID hit. Mary wanted to try something new, and so she decided to bring her entrepreneurial skills and spirit to a startup. She joined Inflection, a company that was creating courses about fertility, written by the most prominent experts in the field, to help people looking to build families but struggling to navigate the medical and financial decisions. Here, Mary tells the story of the problem the co-founders of Inflection identified.
The co-founders, Jake and Deborah Anderson Bialis, started to build their family. They're both technologists and investors themselves living in Silicon Valley. But right away, they found out that there's a lack of quality information and coordinated health delivery available to people as they go through treatments, and in their case, IVF. The information was extraordinarily weak. The access to details about infertility specialists and endocrinologists was nowhere to be found. And patients were paying, and still are today, paying enormous dollars out of pocket, even if there's some employer supplements. And with that, if you're spending $20,000 to $40,000, and depending on your income level, that could be cost prohibitive. The financial stress of those crossroads really put additional pressures not only on the individual, but on their marriage and relationship and the decision making, that they felt this gap needed to be addressed. So they launched what was called Fertility IQ at the time, which was our expert-led education that really helped people at those most challenging medical complex topics, like the ones I described, by providing understandable information in a digital format to people as patients as they go through that journey. And the courses become really a reference library. They meet with their doctor, and in many cases, you might meet with a specialist for only 30 minutes. So how do you go in and meet with a specialist, and they're throwing language out there that's you don't know what it means, and how do you professionally advocate for yourself? And that's what our courses do. They help people digest the information, go back and refer to it, taught by the heads of societies at Harvard and Stanford and medical universities around the world. And we built that platform out from maybe 4 to 5 courses back 10 years ago to now we're in 70 countries around the world with deep courses in local language addressing any of the legislative differences that there might be available in terms of treatment paths and how you use the social system in India, in Spain, in China, to navigate family building. So really, really proud of the work that they did through the start of the business and how that's grown. And the other piece that, aside from addressing the gap and knowing that we wanted to take a path towards employers, we were fortunate enough through our, again, networks, we were able to build out Apple Computer as our first pilot client.
Deloitte, BCG, Oracle, and others followed, and Inflection was turning a profit without any outside funding about a year after Mary joined. And now the courses they've custom created with the most knowledgeable experts on each subject and offer all over the globe have expanded to cover other inflection points and topics that present knowledge gaps, most notably in women's health, the topic of menopause.
I wrote an article for Forbes this year just on menopause specifically, and it's a business issue, right? If you look at it, you're getting women to their productive, most important parts of their career. They're in leadership positions at that point in time when they hit the menopause phases. And Nobody talks about it. Over half of working women are dealing with menopause symptoms. It's almost unbelievable to think that it has taken until about a year ago for the U.S. employers to start to recognize that and address it in the workplace. And so I'm thrilled about it. I'm a graduate of menopause, if you call it that, but seeing how quietly I dealt with menopause in the workplace as a senior executive, and there were many days that I felt like the symptoms were affecting my quality of work. And so it's great to see this shift. If you think about sensitivity IQ, which is basically our manager and allyship offering. So we've got about 15 courses that we use for managers to be better allies if you suffered from a miscarriage or you're going through IVF as an example. But some recent data really blew my mind in many ways. 69% of employees report that managers have more of an impact on their mental health than their therapist or doctor. At the end of the day, more than half of the population is female. I think what catches the eyes of boards and CEOs is having solutions that are really going to address this majority of the global population.
We're wrapping up our episode on women entrepreneurs and women's health with Elissa Kalver, our first guest and the founder of WeGotThis.org. The heart of every business owner's purpose is the way that they're bringing solutions to people and how that aligns with their values. So we asked Elissa what she hopes her daughter will take away from her work and the time that she spends on it, even as she battles terminal cancer. Her answer is purposeful and measured.
It's so important to me that she sees me live with cancer. And so we've been very open about things early on. She didn't understand it, for the first few years of her life. And it was not too long ago, a few months ago, that we really sat down, got some books. There's a lot of nonprofits that do great things for helping parenting with cancer. And really sitting down and explaining to her, why I was bald previously, and what I'm going through and that I have cancer. And it's so important to me because I don't want her to learn about it if I die. And we're all terminal, so I'm going to die someday, and we all are. And odds are that I'm going to die from cancer. But I hope to live a full life with cancer, and quality of life like I have now. And to me, that's beating cancer to my definition and redefining what that means and redefining that success. But I want her to understand those values that I lived on. Whether or not you're going to be able to survive or live with it and what the outcome is. A lot of it is about the community along the way. And I hope that regardless of the outcome, and of course, unfortunately, we don't have outcomes all the time that we want, really focusing on the time that we have and the time that you have to live your life to the fullest. Cancer's not a prerequisite to that.
You can hear more about Elissa's journey, support her cause, or purchase her new book, We Got This: How I Learned to Thrive with Terminal Cancer, by visiting WeGotThis.org. Thanks for joining us for this episode of From Problems to Possibilities. Thanks to our guests, Mary Elizabeth, Elissa, and Professor Glover. We're inspired by your entrepreneurial leadership and the amazing strides you've made in helping everyone access the care and services they need and helping to improve outcomes in women's health. Coming up in the next episode of From Problems to Possibilities, join us as we speak with entrepreneurial leaders who are taking inspiration for business solutions from nature. They're using systems thinking and biomimicry to solve problems from driving growth to becoming water neutral.
The reactions of that communities when the water came in their pipes. That was a game changer for us.
You're listening to From Problems to Possibilities, Entrepreneurial Leadership in Action, presented by Babson College. On this podcast, we hear about how entrepreneurial leaders identify and solve problems in our world straight from the people that make it happen every day in Babson's global community and beyond. I'm your host, Maddie Poirier from Babson College here in Wellesley, Massachusetts. Until next time.